I am Rendell Bolton. I am a qualitative analyst. I am affiliated with the HSR&D Center for Healthcare Organization and Implementation Research, and I'm also affiliated with the Center for Evaluating Patient-Centered Care in VA. The work that I've been involved in over the last several years has really been looking at how patient-centered care as well as complementary and integrative health programming is developing in VA. Complementary and integrative health, there's quite a bit of research out there that shows it's effective for conditions that are pretty common among veterans. Things like pain, depression, anxiety. And veterans are really asking for these types of services, but they're really difficult to get implemented in medical centers. They don't follow the traditional medical model. Medical centers struggle with things like, how do we fund these? How do we hire the right people to provide that service? My work has been looking at how these are being implemented in VA and what some of the organizational factors are that are influencing that. Our work was a qualitative study where we interviewed executive leadership and service line and clinic leadership at 8 different medical centers across the country to really understand what role they were playing in implementation and different factors that impacted implementation of complementary and integrative health at those sites. So some of the things that we found were around leadership attitudes, buy-in, competing priorities, a concern about, there was this concern of like, if we build it, they'll come, and that's really scary because how do we kind of meet that demand? And even when people, either service chiefs or medical directors, chiefs of staff, even if they didn't totally buy into it, there was this attitude that, gosh, if the veterans want this, then let's find a way to do this. We have been working with our operational partner, which is VA's Office of Patient-Centered Care and Cultural Transformation. And that's been a really valuable partnership for us. In that partnership, our work has largely been informed by, what are their priorities? What are the things that they want to know or need to know in order to move initiatives forward and provide support down to the actual sites that are doing that frontline care. Often in research, we go and we do our research, and a few years later, maybe we get a paper out, and maybe a few years after that, we hear about some impact that that's had. And this has been, working with a clinical partner, a much more rapid process in terms of seeing the impact of the work that we've done. We know our work is valuable to them. They are really interested in it. They kind of want it oftentimes more rapidly than we can even provide it. And then they act on it, and they have the power to do that, and that's really rewarding. As part of my research over the years, I've had the opportunity to talk with and interview many veterans, have them share their stories with me, and I couldn't do my work without them. I really, really thank them for their willingness to give back, for their willingness to continue to serve by participating in my research, and that's amazing. That's really amazing. So thank you to all of them.